Welcome back for another week of our pregnancy video series. This week we're going to go over some of the most common complaints that our pregnant patients come in with. So first up is sacroiliac joint pain. The sacroiliac joint, or the SI joint, is the joint found right here between the sacrum and the ilium. So if women have pain in this joint, it's going to be just off center from the spine, really low in the low back, kind of the tailbone area, and it can present on either side. The next most common complaint that we see in pregnant patients is pubic symphysis pain. So our pubic symphysis is right here where these two pubic bones meet. Pain is often either at the top side of this pubic joint or from below, and depending on where the patient has more discomfort can really cue us into which muscles might be more of a culprit in their discomfort. The third most common complaint we see is round ligament pain. So the round ligament isn't shown on this model, but the round ligament helps to support the uterus, and it comes down and it'll attach kind of in the lower outer quadrant of the abdomen. This will often have like a deep kind of sharp stretching pain, often with rotation or some movements like that. And because the ligament's attached to the uterus, as the baby grows and the pregnancy progresses, women tend to have more discomfort in these round ligaments and in the lower abdominal areas. The last of our most common complaints is generalized low back muscle pain. You can see where we have all these little bony stick out parts here in the spine. We have a lot of muscles that attach here. So because of, in part, joint laxity or more movement in our joints, coupled with the changing center of mass, these muscles tend to take on a little bit more work during pregnancy. So we'll often see that generalized low back muscle pain. All of these complaints, even though they occur in different areas of the spine and pelvis and abdomen, can all essentially be traced back to the same root cause, which is a mismanagement of load through the abdomen and pelvis. This mismanaged load can then be traced back to, one, a loss of inter-abdominal pressure, or our ability to maintain a lot of stiffness through our core and abdomen, and also a mismatch between the natural stable, mobile joint pattern that we should see throughout the body. In order to help patients get a better idea of how a loss of intra-abdominal pressure or that mismatch between the stable and mobile joint pattern might be affecting their symptoms, we'll often use this diagram. So just to get a little bit better oriented here, we've got two versions of this. One is the ideal, one is the not so ideal. And when we're looking at this diagram, it's a torso shown from the side. So we have the spine in the back with the tailbone lower. We have the pubic bone in the front. And we've got the sternum in the front with all the ribs wrapping around. Shown in red here, we have the diaphragm muscle, we have the pelvic floor, we have some of the back muscles, and a general diagram of the abdominal wall. We can use this diagram to show patients what the optimal orientation of the ribs and pelvis should be in order to help their core and pelvic floor function as well as it needs to. So here we have the diaphragm muscle, or the ribs, stacked on top of, or basically parallel to, the pelvic floor and pelvis. This stacked or parallel orientation can help us to create good pressure through our abdomen and create stiffness, which is very, very necessary for us to have a solid foundation through our core to make sure we can avoid a lot of those common pregnancy complaints. So we should have this nice system in place. However, when we are pregnant, so shown here by the orange curve showing a larger belly, often we'll get pulled into this position where we have more arching through the low back, and we no longer have that good orientation between the diaphragm and pelvic floor, or ribs and pelvis. So instead of having that good kind of canister look like a pop can or a toddler belly, we end up with this overarched system, which makes it much more difficult to stabilize and tends to contribute a lot more to some of those common complaints. So just looking at the length of the abdominal wall, you can see when we have ribs, pelvis parallel, there's a lot less stretching going on through here. This is an exaggerated version, but you can see that as we open up the ribs and pelvis, we get a lot more lengthening through the abdominal wall. This can lead to worsened abdominal separation. It can cause more pulling at the pubic symphysis, It can cause more compression through the pelvic joints. A lot of those complaints that we see very often in our pregnant patients. Going back to the stable mobile system, we can generate a lot of stability through our core and spine when we're in this stacked position. We lose a lot of that here. So if we end up moving too much, shown here, in an area that should be very stiff, we can throw off that pattern. Similarly, if we have a lot of stiffness through the upper part of the back, which should be very mobile, have a lot of ability to rotate and extend, that can also cause this lower area to take on more work than it's used to. So we use these diagrams often, both during pregnancy and outside of it, just to help patients get a better idea of how some of these changes as far as orientation and muscle activation can be contributing to those complaints.